Join me as I take on the challenge of diving deep into why I fight for Social Security and Medicare, because you really need to know this. Social Security and Medicare are often seen as sacred institutions in American life, providing a vital safety net for millions of people. But for me, it's personal. I've seen firsthand the impact these programs can have on individuals and families, and that's why I'm so passionate about fighting for them. Social Security and Medicare are facing some serious challenges right now. One of the biggest issues is funding. Both programs are facing significant shortfalls that threaten their long-term viability. And to make matters worse, there are always politicians looking to cut benefits or privatize these programs, which would be a disaster for millions of Americans who rely on them. These challenges aren't just abstract problems, they have real-world consequences for real people. For example, if Social Security's trust fund is depleted, millions of seniors could see their benefits cut by as much as 25%. That's a huge deal for people who are already struggling to make ends meet. The thing is, these programs are so much more than just numbers on a budget spreadsheet. They're a lifeline for people who have worked hard their whole lives and are just trying to enjoy their golden years. And they're not just important for seniors. Medicare is also a critical component of our healthcare system, providing vital care for millions of people with disabilities and chronic conditions. When politicians talk about cutting these programs, they're not just talking about saving money. They're talking about taking away the security and dignity that these programs provide. But despite the challenges, there are still so many people who don't understand how these programs really work, or why they're so important. That's why it's more important than ever that we educate ourselves and others about the stakes involved. Because when it comes down to it, Social Security and Medicare are about more than just dollars and cents. They're about our values as a society. Do we believe that everyone deserves access to basic dignity and security, no matter their age or income level? Or are we willing to let the most vulnerable among us fall through the cracks? The history of Social Security and Medicare is a fascinating one. Both programs were created in the mid-20th century as part of President Franklin D. Roosevelt's New Deal, and they were designed to provide a basic level of economic security for Americans who were struggling to get by. Over the years, they've been expanded and modified to meet the changing needs of our population, but the core idea has always been the same: to provide a safety net for those who need it most. One of the coolest things about Social Security is that it's a pay-as-you-go system, meaning that the money that's collected in payroll taxes is used to pay benefits to current recipients. It's a beautifully simple idea, and it's allowed Social Security to provide a stable source of income for millions of seniors over the years. And as for Medicare, it's been instrumental in improving healthcare outcomes for seniors and people with disabilities, while also helping to drive down healthcare costs overall. But despite all the progress we've made, there's still so much work to be done. We need to continue to fight for these programs, to educate ourselves and others about their importance, and to push for policy changes that will ensure their long-term viability. I'll never forget the story of my grandmother, who lived on Social Security benefits for over 20 years after my grandfather passed away. Without those benefits, she would have been forced to live in poverty, struggling to get by on a meager income. But thanks to Social Security, she was able to live a dignified life, free from financial worry. And that's what these programs are all about, providing a basic level of security and dignity for all Americans. I've also met people who have been saved by Medicare, people who were struggling to afford healthcare costs, but were able to get the care they needed thanks to this program. These are the kinds of stories that remind us why these programs are so important, and why we need to keep fighting for them. Social Security and Medicare are more than just programs, they're a reflection of our values as a society. They're a reminder that we care about our neighbors, our friends, and our family members, and that we're willing to do what it takes to ensure they have access to the dignity and security they deserve. So why do I fight for Social Security and Medicare? Because I believe that every American deserves access to a basic level of dignity and security, no matter their age or income level. And I know that these programs are critical to making that vision a reality. Thanks for watching, and don't forget to share your thoughts in the comments about how Social Security and Medicare have impacted your life or the life of a loved one. And if you want to learn more about these programs and how you can get involved in the fight to protect them, be sure to check out my next video on this topic. You are invited to subscribe to Camaraderie Health Agency LLC YouTube channel or www.camaraderiehealthagency.com or 224-433-5754.